Bond. James Bond. What if James Bond were a mental health professional? What if he was a psychologist, or therapist, or counselor? What type of therapist would he be? What type of therapy would he practice? How would he do it? I'm going to begin a series on how famous characters, James Bond, Indiana Jones, Hannibal Smith, the Saint, how they would practice therapy if they were mental health professionals, and how would they do it. Now, to be fair, this is speculative, so I engage the services of Gemini AI to help me speculate exactly what kind of therapist they would be and how they would do it. And so I'm going to share that with you today. So let's see how James Bond, would be a therapist. What type of therapy would he practice? And how exactly would he do it? Okay, so James Bond is an iconic character known for his cunning, resourcefulness, decisiveness, emotional control, often to the point of detachment, charm, and his ability to operate under extreme pressure. He's a blunt instrument of government, master of disguise and improvisation, and driven by loyalty to his mission. Psychological analysis often points to elements of the dark triad: Machiavellianism, subclinical narcissism, and subclinical psychopathy, though also acknowledges his capacity for loyalty and even empathy, which he often suppresses for his duties. He's also portrayed as someone who experiences significant trauma and loneliness, often using drinking and women as coping mechanisms. If James Bond were a psychologist, he would likely practice psychodynamic therapy, but with a very specific, almost strategic approach to it. He would also integrate elements of cognitive behavioral therapy, especially for skill development and crisis management. So let's figure out why. Okay, why psychodynamic therapy with a Bondian twist? First, it would help him unpack deep-seated issues, but with a sense of mission. So Bond's own character is deeply shaped by past trauma, loss, and a learned emotional attachment. While he might suppress his own feelings, as a therapist, he would recognize the profound impact of past experiences on current behavior. He would delve into the unconscious motivations, defense mechanisms, and relational patterns that clients exhibit. However, his mission would be to help the client understand these dynamics so they could operate more effectively in their own missions, meaning their own lives. It would also help him to read people and situations. Bond is a master at reading people, understanding their vulnerabilities and anticipating their moves. In therapy, this would translate into an acute ability to identify underlying issues, hidden conflicts, and maladaptive patterns in his clients. He would use this insight to help clients gain self-awareness. Addressing defense mechanisms. Bond himself employs significant defense mechanisms: detachment, charm, humor, risk-taking, to cope with his dangerous profession and personal history. He would be uniquely positioned to recognize and help clients understand their own defense mechanisms, exploring whether they are serving or hindering them, and focus on relationships or lack thereof. Bond's relationships are often fleeting and fraught with danger or emotional distance. He understands the complexities and often the pain of human connection. He would likely explore attachment styles, relational patterns, and how clients navigate intimacy and trust, given his own experiences with loyalty and abandonment. Now, add in some elements of cognitive behavioral therapy. This includes practicality and problem solving. So despite his deeper psychological leanings, Bond is intensely practical and results-oriented. He focuses on achieving objectives. He would likely integrate CBT techniques to help clients identify and challenge irrational thoughts, develop coping skills for anxiety or stress, and set concrete behavioral goals. Crisis management and resilience. Bond operates in high-stakes environments and demonstrates remarkable resilience. He would apply strategies to help clients manage acute distress, develop emotional regulation skills, and build mental fortitude to face life's challenges. He might even see it as training them for their own missions. And covert operations, or reframing. Just as Bond uses misdirection and subtle influence, he might use cognitive restructuring to subtly shift a client's perspective, or reframe the situation in a way that empowers them to act differently. Now, how would he practice? Well, with a cold analyst and with moments of insight, he would likely maintain a controlled analytical demeanor, perhaps with moments of surprising depth or direct cutting insight. He wouldn't be overly warm or effusive, but his observations would be sharp and precise. Strategic questioning. His questions would be incisive, probing, and designed to uncover hidden information or challenge existing assumptions, much like he interrogates a suspect. Emphasis on self-reliance and effectiveness. While helping clients understand their past, his ultimate goal would be to equip them to be more effective and self-reliant in their present and future. He might focus on developing a client's inner spy, their capacity for observation, strategic thinking, and decisive action. Mission-oriented progress. He might frame therapeutic progress in terms of missions accomplished or intelligence gathered about oneself. And calculated risk-taking in therapy. He might encourage clients to take calculated risks in their own lives, for example, trying a new behavior, confronting a fear, once they've developed the necessary insight and coping skills. In essence, James Bond as a psychologist would be a highly intelligent and astute therapist who, despite his own emotional guardedness, would be exceptionally skilled at dissecting the human psyche and helping clients to navigate their internal and external missions with greater awareness, resilience, and strategic acumen. Would you want to be treated by James Bond, the mental health professional? Why or why not? We'll look forward to seeing you next time.